Welcome back to TV5 News at 9, everyone. Proton therapy, a breakthrough in medicine. Joining us this morning to tell us a little bit more about it is Dr. Christian Hyde, who's calling in. Thanks for being here, doctor. How are you?
I'm doing great. Thank you, Blake.
You're very welcome. Thanks for calling in. So we're going to be talking about proton therapy and breast cancer. So just tell us a little bit of some concerns or challenges when treating breast cancer with the traditional route of radiation.
Yeah, sure. So we know that radiation is really important for breast cancer. With breast cancer, it used to be everybody got a mastectomy, but we know that's overkill. A lumpectomy with radiation is just as curative. But radiation can have some undesirable side effects. Radiation is not a health food. We try to avoid it in our everyday lives, but it's really effective at curing cancer. So we need to be able to hit the cancer and cure it without hitting the internal organs of the body, especially the heart and also the lungs. And sometimes we can do that with X-ray therapy, but not always. And some patients in particular have a big benefit to proton therapy.
Very good, doctor. And so, this leads great into our next question because it is Heart Month. So, you said proton therapy will help tackle the cancer without hurting organs or things around it. So what are some risks to the heart linked to traditional radiation? We're going to stick on that topic of left-sided breast cancer.
Right. Correct. Thank you. So we know the heart points toward the left side of the body, and the breast is kind of overlying that area of the chest, and it's really hard when using x-rays that travel in a straight line to go through the breast and not keep traveling toward the heart. So one of the ways we can use proton therapy is to make the beam stop. And that's one of the special things about proton therapy that's completely unique from other forms of radiation. Totally different from x-rays, which, they go in one side of your body and they keep traveling out the other. Whereas proton therapy goes in and it stops where we tell it to stop. So we can tell it to stop in the breast and not keep going all the way through into the heart. And so for some patients, we don't need to use that level of technologies, but for others, it's absolutely crucial. And in particular, those are patients often who have either a large breast or large area that we need to treat. Like sometimes we have to go into the lymph nodes or the lymph nodes close to the heart on the left side. And I have some images that I think help show that. This is a cross-section through the heart. When we're treating left breast cancer, there are lymph nodes that are right next to the heart. And in order to completely cure the cancer, we have to treat those lymph nodes. We know that those lymph nodes are important to cure. On the left-hand side, we see this X-ray plan. And the X-ray plan, gives the radiation where it needs to go to the left breast, but it also kind of washes through the heart, through the lung, and even sometimes over onto the opposite side, onto the right breast. And that can increase the risk of a breast cancer down the road if we don't eliminate that risk. Proton therapy, on the other hand, we're covering the target, the left breast, just like we need to. We're covering the lymph node area that we know is important for cure, but we're able to stay out of the heart. So the heart's here inside, it's here shown in gray, and we're able to use this very, very tightly shaped 3D dose shaping that's possible with protons that isn't always possible with other forms of radiation. It helps us stay off the heart, and that can help reduce risks down the road. Some of those risks are things like an increased risk of heart attack, or needing a stent, or an angioplasty, sometimes even a fatal heart attack. And so long-term research, over the course of decades has shown there's a difference between patients who get a low dose of radiation to the heart and patients who get a high dose of radiation to the heart. And we want to keep that dose as low as practically possible, and protons can help us do that.
Yeah, it was a little shocking to see how much coverage the X-ray got on the heart in your picture. So why would you say proton therapy is more likely to be the option for left-sided breast cancer?
So I would say in patients definitely who need lymph node treatment, because we're treating a bigger area and we have to treat right next to the heart in order to get those lymph nodes. Sometimes even right-sided breast cancer patients can benefit from that because the right side of the heart is close to those lymph nodes that are kind of between the ribs. And we know that it's not just for left breast cancer anymore. Right breast cancer can also frequently benefit from proton therapy to help protect the right side of the heart.
So Dr. Hyde, if anyone wants to take this information, McLaren, by the way, is the only proton therapy center in mid-Michigan and only one of 2 in the state. So if a patient thinks and they have left-sided breast cancer and wants to get connected, how can they?
Right. So we are on the web at mclaren.org/proton therapy. And we also have a toll-free number, 855-MY-PROTON. That's spelled MY-PROTON, MY-PROTON, 855-MY-PROTON.
Dr. Hyde, this has been a great discussion this morning. Thanks for calling in.
My pleasure. Thank you.
You're very welcome. If you want more information on this topic, just go to the Hot Links section on our website, WNEM.com.